Picture this. It is a warm, sunny day, and you are hard at work at your very important construction job, moving the country onwards on a road of concrete and mortar. Suddenly, you begin to cough violently. You try to drink some refreshments to make it go away, but to no use. If you have developed a violent cough, either from your workplace or from recreational use of tobacco, you may have developed chronic bronchitis. But what is chronic bronchitis? Chronic bronchitis is the inflammation of bronchial tubes and/or the mucous membrane on the bronchial tubes. Bronchial tubes are the tree-like structures that direct air to your lungs when you breathe. Chronic bronchitis can be very deadly. Episodes of coughing can last for up to 2 years, with months of serious coughing that can make you spit up mucus. Shortness of breath and tightness in your chest are also associated with chronic bronchitis. It is not fun. Chronic bronchitis is a disease that never goes away. Chronic bronchitis is a type of chronic obstructive pulmonary disease, or COPD for short. Acute bronchitis is another form of bronchitis. It is less life-threatening and only lasts for a few weeks. When you develop chronic bronchitis, you are vulnerable to attack. Chronic bronchitis makes you vulnerable to viral and bacterial infections. This is due to mucus buildup inside the bronchial tubes. If you smoke cigarettes or any form of tobacco, you are also at risk of chronic bronchitis. Smoke damages small hair-like fibers in your airways called cilia. Cilia is important because it captures dust and filters out mucus. When these fibers are damaged due to smoking, they stop functioning properly and cause chronic bronchitis. How do you know if you have chronic bronchitis? Unfortunately, most people don't know until it's too late. Chronic bronchitis is sneaky that way, and many people are unaware that they have it. Chronic bronchitis affects an average of 11 million people in America, being the 4th most common cause of death. Typical symptoms of chronic bronchitis include coughing, mucus that is clear, white, yellowish-gray, or green-colored, or rarely blood-streaked. Some also suffer fatigue, shortness of breath, slight fever, chills, and chest discomfort. See a doctor if your cough lasts for more than 3 weeks. Prevents sleeping. If you develop a fever higher than 100.4 degrees Fahrenheit. Produce discolored mucus or blood. Have episodes of wheezing or short breath. If you have any of these symptoms, you could have chronic bronchitis. What can you do to prevent chronic bronchitis? If you smoke, then stop immediately. Smoking damages small organs in your lungs called alveoli. These important organs are responsible for supplying oxygen to your blood. If you work in industry and/or dusty areas, wear a mask. Damaged alveoli cannot process oxygen very well, so it is important to protect them as best you can. Chronic bronchitis does not have a cure, and people with chronic bronchitis must live with it forever. But there are ways to treat it. Ask your doctor about getting a bronchodilator, a device similar to an inhaler. Or you may receive theophylline, which is a medicine that relaxes your airways, allowing you to breathe comfortably. Failure to receive treatment early on can result in lung disease and heart failure. Living with chronic bronchitis can be very hard, but just as long as you take your prescribed medicines and stay away from smoking and fumes, and exercise regularly, you will still be able to live a relatively normal life.